Let's talk about really quick a real patient case I want to tell you, because this case goes over what a patient has and the workup that happened before they came to see me and what I can do to help out. So this is roughly a 23-year-old female who's been having a lot of gut issues, bloating, dissension, diarrhea, even to the point where she's getting up in the middle of the night and having some weight loss as well. She was one that's very hesitant about trying to go into Western medicine. She didn't want to be just placed on a pill and be shoved out the door and say, hey, this is done. So she went down a more natural approach. She saw multiple different doctors, including functional medicine doctors, who did a workup. They did some stool testing, did some testing called a GI MAPS test, did other testing for her, which she had to pay out of pocket for, ended up being quite a bit of money, but she got some information, roughly about 30 sheets of paper, about some of the results of that test. This functional medicine doctor told her about different things she can try different diets, try being on a keto diet, try a paleo diet, try to avoid carbohydrates, try these supplements, which she had to pay out of pocket for, very expensive. She had some help. It helped out a little bit, but not to the point where she was fully satisfied with what was going on. She's still having pretty bad diarrhea, still having bloating as well, still having a lot of gut issues. And she was frustrated because she didn't want to go down the kind of the Western medicine path, but at the same time, she went down a more natural path. She paid a lot of money out of pocket for a lot of different tests, tried different supplements, tried different diets, and didn't get the response that she wanted. So she decided to see me and see what my approach is. So I see these patients a lot. So when I saw her, I heard her story, I did my examination, and the first thing I realized is that she's having to go to the restroom in the middle of the night. It's waking her up. So for us in the GI world, those of us who are a trained GI doctor, this for us is a warning sign that something else is going on there. And I didn't want her to have to undergo some crazy different tests that would not help her. I didn't want her to have to pay out of pocket, certainly, for tests that I feel like are not going to make a difference in the care. So I did what I typically do for my patients. I did some really limited stool testing, because stool testing for the vast majority of our patients doesn't really help out with helping us to figure out what's going on with chronic diarrhea. Sometimes I check for some parasites to make sure nothing else is going on there. But I did what I consider the gold standard for us to find out what's going on, which is taking a look with both an upper endoscopy and a colonoscopy. What these tests are, we put you to sleep, use a very small camera. I take a look inside the upper GI tract to see if I can find any reason in the upper GI tract for some of her gut issues. I also did a colonoscopy as well, which on the colonoscopy, it looked to be completely normal. I didn't see anything on the actual scope itself, but I did take biopsies to find out exactly what's going on. She came to see me about a week later, and on her results that we did for her, we found that she actually had a condition called Microscopic Colitis, in which there was underlying inflammation inside the colon that we could not see with the scope, but we can see with biopsies as well. And this is a condition in which you have chronic watery diarrhea to the point where it can be debilitating for your life. This is a colitis that you cannot see on different stool testing, and you cannot see on any imaging. And also on the upper endoscopy as well, she actually had biopsies that we took from her small intestine, which showed she had evidence of celiac disease as well. So she had two conditions that were causing her some really bad gut issues. First thing I did, I put her on a gluten-free diet. Not because it's the fad or because I thought that this may be kind of a new thing, but because she actually had a condition in which a gluten-free diet would help. And number two, I put her on an anti-inflammatory medication to help suppress what's going on in the colon. But I also knew that with all the other things that she was put on in the past, different supplements, different antibiotics, that her gut microbiome was out of whack. She had dysbiosis, change in her gut bacteria, change in her gut flora. So after we put her on the treatment, when she got better, just like that, literally in 24 to 48 hours, then I started a long-term plan to see if we can get her gut back together again, get her healed, and get her taken care of by introducing more plants, more variety, more holistic food, so she doesn't have to have such a restricted diet and be scared of what she's eating. We got her off her meds, kept her on the gluten-free diet, added more plants and more natural approaches to help out with her gut, and she seemed to do so much better. I've seen her 6 months later. Her symptoms have gone away. So she is doing very well when it comes to her particular disease. And so I bring up this story because, number one, I think I see a lot of patients who are looking for kind of the natural approach, which I completely understand. I am for that. I am the type of doctor that wants to get you off your medications. However, at the same time as well, there is a indication for us to use Western medicine to help out, especially whenever we see what's going on. And the good thing about being a GI trained doctor is I can do both. I can help out with what is going on pathologically and also what we can do naturally. And I don't want to give you tests that just don't make sense, which a lot of these functional medicine doctors will do, because you're paying out of pocket for a whole bunch of papers, which makes no sense whatsoever and doesn't help me out. And so I just want to kind of let you know that these are kind of the things that we try to do whenever we're trying to help out with our patients. Let me know in the comments if you feel like me giving these cases are helpful for you, or if you're getting any benefit from that as well.